India and South Africa have led calls for vaccine patents to be waived, in theory allowing more countries to make more, cheaper doses. And now the United States has joined them. It's a hugely significant diplomatic move, but one that's left the pharmaceutical industry, for whom patents equal profits that fund research, unhappy.
Having the pharmaceutical industry as a partner, not a punch bag, is the best way to make this production happen as fast as possible, as it has in the UK in the last year.
The Oxford vaccine was developed here by academic scientists backed with public funds, produced by pharmaceutical giant AstraZeneca and sold at cost. Those behind it say simply handing over the patent will not solve supply problems.
I'm not really aware of any facilities around the world that are suitably equipped to make it that aren't doing so already. So I think in the short term, the next few months, the amount of vaccine that's going to be available is fixed. The question is how it gets distributed.
The industry says that collaborations like this, bringing together academic know-how with public money and the scale provided by Big Pharma, has been fundamental to the success of the vaccine programme. And the real question that developed nations should be considering is not whether to give away the patents, but whether to give away the doses they already have.
In African nations, COVID-19 has echoes of the AIDS epidemic, when patents prevented affordable versions of life-saving drugs reaching millions of people. COVID vaccines are more complex and harder to reproduce, but the memory looms large.
That generation that lost loved ones to the delayed response to actually ensuring equitable access to necessary commodities to save lives, that generation is alive today, and those memories are alive today.
The British government has not followed America's lead, but says it will work with the World Trade Organization to increase supplies. But that could take months. And until then, the world's poor will rely on the rich to share the doses they need. Paul Kelso, Sky News in Oxford.